Now I'm already in this situation, so to speak, where I have silent inflammation, possibly even multiple ones accumulated over decades, as is very often the case as well. Can I still turn things around now, or is it too late?
No, you can always turn it around, and you should. So imbalances should always be corrected, whether that's as acutely and quickly as possible or just slowly but clearly. That's up to each individual. You just have to get a holistic picture of the matter, of the overall situation, also of the life situation, lifestyle situation, nutritional situation, but also of local factors, keyword oral cavity. Of course, you have to look closely at the condition of the teeth, the restoration, the periodontium, meaning what kind of periodontitis is present or not. Sometimes you can even give the all clear. You have to get as holistic, that is, comprehensive a picture as possible, including blood values, inflammation markers, and so on, to then see where improvement measures can be implemented most effectively. Sometimes it happens extremely quickly.
Welcome to Longevity to Go. I am Dr. Barbara Bauder, and this podcast is aimed at people who bear responsibility, entrepreneurs, decision makers, and creators. People then who have built something and are doers and understand that energy is the actual currency. At 30, you compensate for intensity. At 45, intensity is accounted for. Biolongevity is my approach for sustainable stability and sovereignty over decades. With the pillars of health, wealth, and privacy AI, biological regenerative capacity, economic clarity, financial stability, and conscious wealth creation, digital sovereignty. In this podcast, we connect these levels. We talk about systemic health, about structural prevention and resilience in the nervous system, stability also in metabolism, clarity in decisions, and protection of cognitive resources. The conscious building of wealth as a form of freedom, and about the intelligent use of AI as a tool for clarity, structure, and self-determination. Longevity arises where systems are consciously designed. It's about building and further developing your strategic life architecture. Longevity to Go is part of a larger whole. The BioLongevity Alliance is a curated network with clear standards. And our membership, Longevity to Go, is a supporting framework for all those who don't just understand, but implement. Podcast Alliance membership, a system, an integrated system for sustainable stability. Every episode begins with a central question, namely, what does real longevity mean to you? Not living longer, but staying powerful in the long term. Economically clear, biologically stable, and digitally sovereign. Health, wealth, privacy, AI, that is longevity to go. Most chronic diseases don't start in the hospital. They start beforehand, creeping in with silent inflammation. Welcome to our podcast, Longevity to Go. Here, everything revolves around health, wealth, privacy, AI. I'm very pleased to be here today with Dr. Robert Bauder to talk about silent inflammation. Hello, Robert.
Hello.
If we look at the major diseases today, Alzheimer's, heart disease, diabetes, and so on and so forth, then they all have one thing in common. They start somewhere very slowly, unnoticed, without us actually being aware of it. The common denominator is chronic inflammation. Robert, you've been working as a biological dentist and sports dentist for over 30 years now. When did you actually realize for yourself for the first time that inflammation in the mouth is always a systemic issue and above all very detrimental to longevity?
Basically, I recognized that certainly 25 or 27 years ago. By the way, it's been scientifically well documented and well known since then. But as a younger doctor, you might not have such an overview of things and are too, shall we say, dentally limited to the target organ of the tooth in your perspective. But of course, the oral cavity and the teeth are part of an entire system. And especially chronic inflammation, as you've already mentioned, is to some extent the common intersection. Chronic inflammation is a mechanism that can cause a lot of damage in a target organ like the oral cavity, but can also cause a lot of damage from a target organ like the oral cavity through its systemic effects. So chronic inflammation is generally a common denominator in the organism, an intersection, a complex situation that can lead to gradual accumulating imbalances and organ damage with sometimes very, very, very unfavorable consequences. On the other hand, it's also a huge opportunity if you know how the mechanisms work in principle, so that by improving the environmental factors, you contribute to health being created. We are far too focused all the time on the topic of disease, avoiding disease, chronic disease. Of course, we want to avoid diseases, but we should actually focus more on how we create health. That is how we ultimately organize a healthy environment in a targeted way. That comes through knowledge and of course experience, but also a certain discipline, just doing it so that we positively organize health for ourselves. And you can do a tremendous amount there. And I think that's also what today should be a bit about. As I said, you mentioned it, chronic inflammation is basically the fundamental mechanism underlying many chronic systemic diseases and is practically a common denominator. But there are also other main factors or main complex situations that play a role, both in dental and oral diseases as well as systemic diseases. And that is mitochondrial dysfunction. So ultimately, the central energy supply in all of our cells. This ultimately plays a decisive role in all chronic diseases, as do chronic inflammatory mechanisms. And it's also about environmental factors like the microbiome, balance or imbalance. Those are also very fundamental mechanisms. And when you take it all together, you can see that it's simply about certain environmental factors. I call it that deliberately because, as you hinted, chronic diseases never arise suddenly, but are actually the result of long-term imbalances or misalignments. That's why they're called chronic diseases. So for those who don't know, it means chronos, time in Greek. And it's simply about long periods spent in imbalance, which can also lead to long-term serious problems. Or the other way around, if you chronically do everything right, then chronically, meaning long-term, much remains good. And here in the Longevity to Go podcast, we ultimately want to present positive strategies on how we can achieve optimal longevity. Yes, and we practically want Longevity to Go, which is your brand, to ultimately provide viewers with clear, concrete, and straightforward measures so they have effective, easy to use, everyday tools or practical steps to improve things for themselves. Because ultimately, you can talk for hours about the mechanisms, which is certainly very interesting, but in the end, it's about what I can specifically do to improve something. And that's what we want or need to do ourselves, because ultimately we're only human. Maybe we know much more about one specialty or another, but then something else is missing. It's about bringing the knowledge together here and ultimately breaking it down into simple, efficient tips.
Exactly right. Basically, it's about breaking down the complexity of everyday life, which is divided into these pillars, health, wealth, privacy, and AI, into simple, digestible bites, so that it's strategically and tactically possible to implement these things in daily life and achieve the longevity we all strive for in the long run. You basically summarized one thing earlier. The mouth is not an isolated system, but plays an essential role or is an essential part of the entire immune system. Yes.
Not just the immune system, sorry. Not just the immune system, of course, but also the immune system.
Also the immune system, exactly right, yes. There are numerous studies showing more and more clearly that chronic inflammation ultimately plays a central role in the aging process, if not provoking aging altogether, yes. Many studies prove or describe the word here, inflammaging. What does that mean specifically also from your range of experience? What do most people struggle with there, and what can one actually also understand by silent inflammation for a layperson who has never dealt with it before?
So, to explain the wordplay or word creations again briefly. So, inflammation is the swelling, right? And inflammaging is basically the aging process triggered by that inflammation. So, everyone wants to grow old, chronologically speaking, but no one wants to be old, meaning like sick and worn out and just done for. You want to be fit, live a long time, which is why the term anti-aging is also a bit, shall we say, contradictory. So I would say we want to have a very long health span chronologically, and that's actually better aging, or, well, longevity as it's called. So just so no one gets the wrong idea, no one has anything against old people, quite the opposite. We actually want to grow old healthily and contribute to making that possible for all. Back to your question. Inflammaging, that's the wordplay. So bad chronic inflammation ultimately makes you old through countless mechanisms: cell aging, brain aging, vascular aging, and ultimately leads to an eventual failure of the organism, meaning you die or develop other worse systemic diseases that ultimately end fatally. So we try to prevent that and maintain maximum health for as long as possible. Put simply, because chronic inflammation is a constant aging factor. The natural rust protection, if you will, is anti-inflammaging. So what can we do? Optimize systemic factors. And there are some very, very effective things you can do. Nutritionally, lifestyle-wise, you can contribute a great deal. And to your question of why the oral cavity is important here as an open system, of course, the whole organism is basically an open system, and particularly open is, of course, the system in the oral cavity, and the gateway to the digestive tract plays a key role here, a gatekeeper function. And yes, very, very common systemic diseases in the oral cavity are simply gingivitis, periodontitis, meaning gum inflammation, and inflammation of the tooth supporting structures. So roughly 50% of all adults and older adults have mild to moderate or even more severe periodontitis. And empirically speaking, there is simply a really large disease burden here that contributes to many aging factors through a lot of inflammation via many mechanisms. That's why we have, coincidentally or involuntarily, a fairly crucial structure in the oral cavity that ultimately contributes a lot here in both a positive and negative sense. That's why it's quite important to deal with it and to know how to at least largely prevent chronic inflammation here, or treat it effectively, or prevent it at its source. Ultimately, it's always about really addressing the causes and not treating in a symptom-oriented way. Of course, that's occasionally important and also really urgent and helpful, but actually it's about preventing or stopping the development from the root cause. And especially in biological holistic dentistry, or as we call it, in biological dentistry, in longevity dentistry, this is of course extremely possible. And it's always a prevention-oriented dentistry, so medicine combined with dentistry. And that's the actual bio-longevity dentistry, which basically acts primarily prevention and cause-oriented and always holistically, and can thus prevent the worst from happening. And another part is basically the operative, curative, treatment-wise. When the damage is already done, how can you then optimally organize the best restorative solutions with which strategies, so to speak, to then ensure again that these perform their function well for as long as possible, ideally a lifetime, and cause no harm.
In summary, one can say that low-grade inflammation is actually present, that the immune system is permanently activated by these silent inflammations, and that ultimately there are no acute symptoms. But isn't that exactly the main problem, why people often don't know it at all, or overlook it, or have no options for action, because they simply don't notice it? And ask differently, how specifically, or what do you recommend from, when do I actually notice that I have silent inflammation? Do I already have to be in a state of total sleeplessness? Or what are the issues where you say at this point everyone should really realize that they are now dealing with silent inflammation in the jaw?
Well, it's certainly a somewhat unfavorable situation because, as you already said, silent inflammations are called silent inflammation because they don't hurt, because they don't scream out loudly through pain and symptoms. And that is, of course, the silent danger. We pointed it out in the book, Silent Root Cause. The problem with silent inflammation is that they go unnoticed and can still cause damage. It's like with other risk factors in health science, such as blood pressure that's much too high doesn't hurt per se either. A blood sugar level that's too high doesn't hurt per se either. So there are many risk factors that are truly evident and have very strong effects, which are in themselves unnoticed. That's why you have to be aware of it and simply check how I can prevent it. For example, blood sugar. How can I regulate that sensibly? How can I avoid excessive blood sugar spikes? And those are all important things. I think, first of all, the awareness and knowledge of basic mechanisms must be there. And of course, you can also, with appropriate regular examinations or even measurements of biomarkers or monitoring of certain blood values, for example, blood sugar levels, insulin levels, and so on. The permanent monitoring of such values can of course contribute a lot, but the basis should be that you don't need 1,000 devices now. And various gadgets, which are certainly very useful in part and can provide great things, can provide great data. But I believe the basis is always a natural, conscious know-how lifestyle, and that know-how is what we want to provide here. Because I don't think it's right that one, in order to get healthy, to want to age healthily, inevitably has to constantly run around with like 5 gadgets and devices just to constantly monitor yourself properly and track your sleep and constantly collect all sorts of parameters, because otherwise you somehow think that everything is going wrong. So basic examinations, basic knowledge is simply the key. gladly supplemented by corresponding measurable devices, depending on your personality, of course. The industry can make a great contribution there. Personally, I'm not a huge fan of it, but it's great that we have things like that and that we should also check things occasionally.
Mm-hmm. There are some really great studies on the things you just mentioned. For example, there's the Canto study, which says that targeted reduction of inflammation can, for instance, reduce or lower the risk of a heart attack. Then there are studies proving that through neuroinflammation, so to speak, contributes to the development of Alzheimer's per se. And what I also find super exciting is the area of inflammation disrupting insulin signaling pathways. What interests me now, and perhaps our listeners too, is that I'm already stuck in this situation, so to speak, where I have silent inflammation, possibly even multiple ones accumulated over decades, as is very often the case. Can I still turn things around now, or is it too late?
No, you can always turn it around, and you should. So imbalances should always be corrected, whether as acutely and quickly as possible or simply slowly but surely. That's up to each individual. You just have to get a holistic picture of the matter, of the overall situation, including the life situation, lifestyle situation, nutritional situation, but also of local factors, keyword oral cavity. Of course, you have to look closely at the condition of the teeth, the restoration, the periodontium, meaning what kind of periodontitis is present or not. Sometimes you can even give the all clear. You have to get as holistic, that is, as comprehensive a picture as possible, including blood values, inflammatory markers, and so on, to then see where improvement measures can be implemented most effectively. Sometimes it happens extremely quickly. And if you usually take, let's say, coordinated measures, so that you don't just treat the periodontitis locally, which is of course very often necessary. And you rarely get around that, but of course you also have to optimize systemic factors at the same time. For example, improve the general systemic inflammatory tendency. A typical keyword here would be, for example, the omega-3 to omega-6 ratio. So we almost always have too little omega-3 and too much omega-6 due to our typical Western diet. With the typical diet anchored in the Western world and lifestyle, most people are set up to be too pro-inflammatory. And you can really counteract that effectively, but that doesn't mean you should stop brushing your teeth. It's a matter of both and, rather than either or. And experience shows simply over the last 30 years of clinical practice and continuous care of affected patients that if you optimize the key factors, you can, let's say, for example, that we are able to improve at least 90% of cases very, very significantly and quite quickly, both in terms of reducing inflammatory tendency and also in alleviating local symptoms, and do so in a way that is very sustainable. The only potential issue is if the environmental factors are only significantly improved in the short term, and the chronic imbalance that led to the development of diseases such as periodontitis is not also seriously improved, then a local therapeutic measure often remains, so to speak, a drop in the ocean and only a very temporary improvement of the overall condition. This means that you have to consistently carry out the right treatment measures locally, but at the same time improve the underlying systemic factors so sustainably that it stays good permanently. And you always have to think long term, because that is why we call it bio-longevity dentistry. Because longevity medicine is really always about thinking in terms of decades. And it is always about the long-term effects. And we also have to do things right in the long run so that we can organize maximum health for ourselves.
So, in other words, you could actually say that you are a kind of company yourself where you assess the status quo and say, okay, where do I actually stand now in terms of overall health? And, or as we understand it with our longevity, to go approach considering all pillars, including health, wealth, privacy, and also AI. I do a status quo analysis to then basically determine where the biggest, strongest levers are that I can apply immediately to achieve longevity or to implement a happy, long and satisfied life.
Yes, exactly. So we can definitely view ourselves as a complex corporation. We have, I don't know the exact number, 50 trillion cells. Those are all our employees, and they in turn have many cell organelles. The most important ones are, for example, the mitochondria. And it's like AI agents working for us, and we have to feed them optimally in the truest sense of the word, care for them optimally, but also challenge them and let them work in eustress, meaning let the muscles work, let the joints work. As they say, if you don't use it, you lose it. Yes, so nice. So you have to use things positively and challenge them positively so that they stay functional. Otherwise, we'll get rusty mentally too. If you don't challenge the mind and the brain, we get rusty. And that's exactly how it is. We have to manage our system, our private corporation, so to speak, in that way too, even entrepreneurially in a sense. We also have to lead it because, of course, we're living in a time of transformation anyway, whether we like it or not. We have to lead it with a vision somehow, our personal corporation, meaning our entire organism. And of course, it's not just about purely physical things. They play a very important role, of course. We only have the one body that we've been given. But we also need mental leadership. We have to lead ourselves. And of course, we also need spiritual leadership, because without meaning and awareness, it's literally meaningless. And without a positive spirit, what is it all for then? Yes, well, I think those are different topics again, but we're a kind of private corporation that we should consciously imbue with meaning, and we should bring it to life, I think.
That's ultimately our goal, to say that leadership is required now, meaning leading oneself to bring all these pillars into harmony. That brings me from the health pillar to the wealth pillar, meaning prosperity, or ultimately performance, which is destroyed by inflammation. How do you see that? Longevity isn't just about lifespan per se, but about maintaining energy, clarity, and performance as well as possible and for as long as possible. And I noticed that many entrepreneurs don't even realize that inflammation significantly affects their performance. That means you often hear, oh, I don't understand it at all. I'm so tired. That's the classic. Why am I suddenly so exhausted? It must have to do with other things that we'll also get to. What interests me is, you mentioned mitochondrial function, neurotransmitters, sleep quality. All of that is ultimately influenced by chronic inflammation. There are numerous studies that now prove that fatigue, depression, and cognitive exhaustion stem from that. This means that chronic inflammation ultimately costs us not only our health, but also our productivity and performance. Where would you start here? What specific points do you see where you'd say, if at least this one point is addressed, it's already a step in the right direction?
Well, what you're saying isn't just a vague claim. We know even from sports dentistry and also from sports medicine, not just dentistry, that ultimately chronic inflammation basically also significantly reduces the VO2 max, which is the maximum oxygen utilization. And it's also scientifically proven quite clearly what you just said, that chronic inflammation literally costs life energy, not just in a mental or spiritual sense or fatigue, but actually in a measurable, let's say, athletic output. That's very clear. By the way, that's also a basic mechanism, if I may digress for a moment, that of course chronic inflammation caused by, for example, dead teeth and so on can actually top athletes hinder quite severely in their performance. I mean, extremely. And of course, things like periodontitis or toothaches or a malocclusion can also, of course, have an extremely negative impact on the performance of top athletes or even amateur athletes measurably. But getting back to your entrepreneurial approach. Clearly high performers, and everyone is a high performer in some way. It doesn't necessarily have to be the self-employed entrepreneur. Primarily, everyone is their own personal brand in a way, whether they like it or not. Yes. And that means, of course, chronic inflammation is an energy thief in every respect. Firstly, it leads latently and also daily to a reduction in energy, to poorer recovery, then subsequently also to pain and downtime issues and distraction in a way. Chronic inflammation also prevents recovery, and thus quite clearly measurable. If you were to look at it economically, it is of course a negative dividend in a way, because it always drains performance from one's own life. And the effectiveness in every respect, be it maximum joy or also economic success or even performance as you call it, is naturally negatively affected. And that's like a minus, a negative performance in a portfolio. If you were to look at it from a wealth management perspective.
What role, for example, does the area of bruxism play here? That is the typical teeth grinding at night.
It does play a role, one has to say. Bruxism itself is quite widespread, especially among performance-oriented people, but it's not per se a disease in itself. It's more of a personal quirk. Some people might tend to bite their fingernails as a way of coping with stress, others to some other displacement activities or actions. Yes, and a certain proportion tends to clench. These are often strength athletes or certain entrepreneurial personalities or very ambitious individuals. It's simply a personal quirk that these personalities are prone to. But what we should do is establish protective mechanisms, so to speak, or also a awareness of it to give to the people affected. So protection against tooth damage, protection against jaw joint damage, but also protection against, let's say, mental, psychological exaggerations, and of course also behavioral measures that ultimately eliminate excessive clenching and the resulting damage as far as possible. These can also be restorative measures that ultimately rebuild and protect the teeth permanently, like retreading a tire or a tire change so that you practically have optimal grip again. And it's just the way it is. Everyone is different. Some tend to clench and grind. And another factor is, of course, eliminating interference fields. So, for example, chronic interference fields in the jawbone caused by, for instance, dead teeth or chronic jawbone inflammation can also contribute to ultimately forcing grinding behavior or clenching behavior or tension. So there too, you have to take a multi-causal approach and a holistic approach because many factors also play a role. But there are also other factors such as supplementation. The keyword magnesium would be one such factor here, omega-3 fatty acids or simply amino acids for neurotransmitters. So here too, the overall organ function must be taken into account, and the entire metabolic function is also very important. You might not believe it because it's always just the secondary consequence of other imbalances, but ultimately, when the entire system settings are orthomolecularly optimized, the tendency to grind, even if someone fundamentally has a personality trait for it, is less pronounced. That's quite clear.
What I notice in this context is many entrepreneurs like to delegate logically, and they also like to delegate health decisions. That means, how do you see that in times of Dr. Google, where on the one hand, you can get a lot of information to know what is supposedly happening to you right now or not. At the same time, you might then take certain suspected diagnoses that you've had made for yourself by Dr. Google to a doctor, and then you delegate very heavily. Do you think that's good, or do you say it's actually the time now, and especially also through the use?
Yes.
Or the potential applications of AI, that you ultimately establish a completely new dimension of learning for yourself in this regard? Yes, establish. In the past, medical school was 10 years or whatever you had to invest. Nowadays, you can have overall context analyzed for you in a very compressed way. Is this a new era dawning in people's own perception, understanding, and also implementation when it comes to the health pillar?
Well, it's certainly a new era. I mean, Google is, of course, a curse and a blessing at the same time. On the one hand, it's a great source of information even before AI. You can research very well, but you can also definitely let it drive you crazy. And of course, you have to distinguish between currently so-called AI-generated statements. They are also very steerable. In a certain way, you also have to be very careful. You shouldn't let yourself get driven crazy in principle. And you should definitely look for one or two good doctors, maybe really good healers rather than just good medical professionals. What I mean is a specialized medical education doesn't necessarily make you a good doctor per se. You have to differentiate a bit because there's also a lot of human practical experience that definitely plays a huge role and that no AI can replace, at least not at the moment. So gathering information via AI is a great thing, and it's also important and anyway indispensable nowadays, and it actually helps too. But the initial question was also about delegating health decisions. So one thing is also clear, and that's what this podcast and our contributions are meant to help with. Organizing your own health is primarily about taking personal responsibility. And AI can, of course, help us a lot with research or with, let's say, questioning all sorts of things. It's a really great, helpful tool. But we must always know, and this applies to everyone, including doctors and medical professionals, of course, that you're always responsible for yourself. And every person, every individual is also very different, and it also varies in different life stages, what's good and what's not so good. There are simply different phases of life and also different life circumstances. It's not always one size fits all, which is why we always need individual medicine and individual therapy decisions. And yes, there are also individual priorities and preferences that people have, which you also have to accept. This is especially true in dentistry as well. Not everyone wants beautiful teeth, you just have to accept that sometimes. But anyone can have beautiful teeth if they want them, if they set the right priorities. Just as an example, maybe not everyone wants to be optimally healthy. You have to accept that too. But if someone wants to achieve optimal longevity, they should, at least in my advice, autonomously and responsibly take care of their own health. For that, you occasionally need good professional support and help. Yes, occasionally, rarely you might even need typical pharmacological medications, which can also help a lot. But basically, it's primarily about, through your own autonomy, through your own knowledge, through self-governance, or whatever you want to call it in modern terms, consciously and autonomously guiding yourself towards health and individual optimization. And you can actually manage 80 to 90% of that well yourself and significantly improve it. What you might need is an occasional motivational partner and inspirational input regarding knowledge and actions. There's a lot you can do there. AI or relevant knowledge channels naturally help enormously there as well. But I warn against blind activism, and I also warn against unreflective one-sidedness.
You mentioned an important point, and that is this reflection. I can really only recommend to every entrepreneur, for example, that they set up their own AI agents as a kind of sparring partner to discuss these things with in an interplay. But what I've also seen in recent months in my own use and what I'm experiencing, aside from garbage in, garbage out, we all know that. That means if I can't cognitively manage what I put in and combine it strategically, it's only of limited use to me. But I also find that AI is very seductive. That means the fact that I can enter into a discussion about what I could do now to lose weight, for example, right? And then you might talk to the AI for hours about all the things you could possibly do. At the end of the day, keep it simple. It's always about saying, what am I doing specifically? And I believe that's also really the key to success. And I see it in psychotherapy as an example that the biggest lever is actually the moment when the person decides for themselves to step out of their comfort zone to ultimately work on themselves and take very specific measures. And often just one is enough. I'm just giving the example of when people are depressed or having a depressive episode. Of course, it's easier to perhaps indulge in medication. The question is just how effective it is and what goal I want to achieve at all. It might even be more beneficial to go out into the fresh air, move around in nature and sit in the sun for a bit and consume vitamin D, so to speak, in order to be successful accordingly. I'd like to conclude this pillar of prosperity for now and move on to the next point, which is also very, very important. And this whole topic of health data, it is...
But may I ask a question? How do you define prosperity?
How I define prosperity?
In this context here?
In the overall context?
Yes, in this context here, as you see it.
Yes, it's naturally an individual definition of what prosperity means to someone. One person defines it very strongly, of course, with material aspects, meaning that they are secure, that they can afford the future accordingly and afford the present. For me, it also means a lot to have, so to speak, assets that move and engage on the spiritual level as well as on the mental level. Because it's all of no use to me if, for example, I'm very wealthy now, but a huge crisis comes or war comes or something that completely throws me off balance and I'm not resilient, so not mentally strong enough to face it accordingly, to be solution-oriented, to be able to adapt, then all of that is of no use to me. That means at the end of the day, you can't take any of it with you anyway. The question is also always, what is my vision for my life? What do I want in life to accomplish, maybe even to achieve? Is it my goal to have a family, to have children, to pass something on to the children? That's highly individual. So prosperity means a merging, actually, of the aspects that define my quality of life. And that is just highly subjective. One person says they want to have their yacht in Nice, and the other says, no, actually, a little cabin on the mountain is enough for me. It's very, very relative.
Mm-hmm.
Yes.
Yes. But I also think no money, no honey, and without health, everything else is nothing. That's just clearly the case.
Of course, that's why it's such a huge challenge, this complexity again, ultimately facing it and saying, how can I integrate these pillars, this prosperity, wealth, privacy, and all that in an extremely dynamic environment with AI, for example, so that it's a complete picture for me and it fits. And that won't be the same in every phase of life either. Yes. I mean, it's not for nothing that there are numerous studies showing that, for example, people who have great self-esteem in their early 20s suddenly have no self-esteem at all at 50 or 60 because all of a sudden, through life changes or perhaps through events, traumatic experiences, so much has changed for them that they no longer believe in themselves.
Mm-hmm.
That makes what we said before even more important, the topic of self-leadership. That means developing leadership qualities for yourself, permanently learning about yourself, not with an attitude of, I have to now, because that's already negative anyway, but in a positive spirit to say, I just want to permanently develop myself in my life, because that is ultimately perhaps the greatest summary of prosperity. If I'm permanently developing myself, I never stand still, not with an element of stress, but simply to be able to be permanently resilient, because the more you learn, the more experience you have, the better you can navigate situations that might not always be positive. And everyone has those in life.
Likewise, every crisis is always an opportunity.
Definitely. Exactly. Or the greatest teacher. Exactly. I wanted to come to the topic of privacy, specifically health data. It's definitely clear that health data also represents a kind of new currency. How do you see that? A lot of people use wearables, biomarkers, diagnostic procedures. That means they're ultimately permanently giving their personal data to institutions that measure, track, and further evaluate things. It's a huge bundle of data just to achieve the measures or goals they want to implement. But for me, the question then arises, who actually owns this data and what is being done with it? And how can I protect myself? How do you evaluate this development?
Well, it's similar to, is the internet good or bad? Or is AI good or bad? You can ask, or are computers per se good or bad? It's always a double-edged sword. And of course, to gain insights, huge data pools actually must or should, technically speaking, be evaluated and also tracked. You just don't get any major insights from that. But of course, in the real world, all of this is extremely economically driven and triggered. These are all profit-seeking companies that ultimately exploit and collect health data, to put it negatively. And of course, data is the new gold. We've known that for a long time. That's basically been the case since the internet began. And of course, it's becoming more and more Web 2.0, Web 3.0, and naturally, and health data in particular is of course a huge treasure trove, which logically won't only be used for the benefit of the individuals providing that data. We just have to be aware of that. Ultimately, with every search query we make anywhere, we trigger some kind of algorithm. That's just how it is in this new world. Or it's not so new anymore, it's always the inevitable flip side of the coin. So I don't want to judge it at all, me, purely subjectively. Personally, I'm more of an old school person because I was socialized differently and come from other decades. That's why I'm not a huge fan of data collection per se. For me, I don't go running around with all sorts of trackers all the time. Nevertheless, I try very hard to listen to myself and ultimately my individual intuitive health data. To listen, to capture, and above all, to feel it during training or otherwise. But others have a completely different approach and want to measure and know everything exactly, which is perfectly fine. But at the same time, a huge machinery and a massive industry are inevitably being fed by it. So if there's a good intention behind it from the corporations, there's nothing wrong with it per se. But that's also part of this transformative world, that you have to look at the whole picture of how society will be organized in the future. And what we provide, that's why we also have this topic of privacy. Because I think there are already very big challenges in modern life in general, so to speak. Because self-determined autonomy and freedom are very, very important values to me. And also a certain lack of surveillance, whether intentional or unintentional, is an extremely high value for me personally. That's why, to digress completely, cash is also freedom in practice, but sometimes you're not even allowed to say things like that nowadays. Nevertheless, electronic card payments and mobile payments are, of course, incredibly practical. That is perfectly clear. So there are always multiple sides to it.
Exactly. That's ultimately how it is with artificial intelligence as well. The question is always, who does it serve? Or to put it another way, does man serve AI or does AI serve man? I think that certain scenarios being presented here are also unnecessarily frightening people. I'm just saying, when the media says that all sorts of jobs will soon be eliminated because they're all being streamlined and only artificial intelligence will do them, the same applies to your original or primary profession, so to speak, biological dentistry. How do you see that? On the one hand, there are many advantages to integrating AI into your own business, so to speak. On the other hand, it might actually be the case that certain things will become obsolete. Maybe in 10 years, the computer will actually be the only thing operating on the patient and placing the implant, and humans will have nothing more to do with it except maybe providing some kind of guidance to the patient.
Sure, no, completely realistic. So it's definitely the case. I mean, due to the almost over-exponentially rapid increase in the capabilities of AI systems or application possibilities, in my opinion, it's actually not unrealistic that in 10 or 20 years, even a profession like dentistry, which is very craft-oriented in its daily work, might no longer exist in this form. So I do think it's realistic that actually corresponding, let's call them treatment robots, and especially diagnostic robots, could ultimately handle a lot here, if not most of it. I think that's quite realistic. In that sense, a main field of activity of the current profession of, for example, doctors or dentists will probably really be taken over by AI-controlled, let's call them humanoid robots or treatment robots. I'm not even saying surgical robots, because there aren't just surgeries. There are many other treatments that also need to be done. I can certainly imagine that a lot is possible here in terms of execution. And then there's still this romantic image, that humans will only monitor whether everything is running correctly. I don't even know if humans are that good at it, at monitoring. Maybe there will also be an AI for monitoring. That's why some visionaries, whom some in turn consider crazy, say work is optional in a few years. That could well be. It's all a question. So the question was, will it change significantly? I do think it will change significantly. Even now, we already see many useful applications, but I can certainly imagine that such professions will also be fundamentally changed. And yes, even now, we're noticing that in very traditional industries, a very dramatic change is taking place in the working world and also in the existence and number of corresponding positions. So there will certainly be strong economic and social upheavals unavoidable due to this rapid development. The only thing I believe AI cannot replace for us is ultimately consciousness and reflection. That's why it's always important to consider what the meaning is or what we're actually doing on this earth or in this life. And I don't think that will necessarily be replaceable by AI. But that's exactly the question, because in our daily routine, in our everyday work, we're usually busy 60 to 80% of the time with daily tasks or what we were trained for, where we fulfill some function to solve a problem. If that were to naturally disappear by 80, 90 or 95, 99%, what is our purpose then? What do we do then? What do we occupy ourselves with then, and how do we reflect then?
Then maybe, just maybe, we'll finally tap into the creative power that really should have been brought back to our minds long ago, as it should have been anyway.
Yes, but even creative power or artistic power is also significantly simplified and improved by AI. I'm just saying photography, if you've perhaps been out in nature as an artistic hobby photographer searching for some particularly beautiful, creative or truly inspiring scenes, and when you occasionally find them, you can basically generate even more amazing and breathtaking nature scenes with artificial intelligence just by using a few simple command prompts.
Sure, but maybe people will focus more on family again and want to develop those values accordingly, having more time and quality for it, which is also a nice aspect, for example, or more social involvement to contribute here as well. I think there are already many, many possibilities. And above all, humans are super creative and will, as you rightly say, I'm also firmly convinced of this, humans always need something creative, something where they can draw strength in the truest sense of the word. And that ultimately also means an activity. It's just that in a certain performance-oriented society, it's sometimes, I don't want to say misinterpreted, but it's simply associated with a negative aspect. I have to work. In principle, you don't have to do anything, right? It's always just a question of what attitude I have towards what I'm doing. And the moment I do something that fulfills me, whatever that is, yes, it's no longer a must, but you do it gladly. And that, I believe, is the difference in substance. And if we humans can find our way back to doing things that we simply love to do out of intrinsic motivation, then this question doesn't arise. But we all don't know in which direction it will develop. All the better. That means we can also actively shape it. And that's also our approach ultimately with Longevity to Go. And if we go back to the origin of our podcast today, it's about looking at the topic of inflammation ultimately and what that can mean for humans. What would be the one message you'd like to give people today on the topic of longevity and inflammation, and what everyone ultimately has in their own hands?
So to achieve good longevity, to then be able to unfold it creatively, mentally, spiritually, optimally, creatively, you need, at least for now, a healthy body, a healthy brain, and a healthy organism, more or less. And that inevitably means that I have to make sure that as little inflammaging as possible takes place. It won't be entirely avoidable, and it's not 100% necessary to avoid it, but in principle, you should avoid it. And you can contribute an extreme amount to that through lifestyle and nutrition. Yes, dental and oral health also play an enormous role, so quite simply, treating gingivitis and periodontitis, avoiding the causes, to prevent joint inflammation so that movement and sports are possible. Of course, regarding brain health, preventing periodontitis ultimately enables healthier, longer-lasting brain function because conversely, periodontitis maintains neuroinflammation in the brain via certain bacteria and thus contributes to cognitive, intellectual, and mental decline. There are many relevant studies on this and of course to cardiovascular decline as well. So, avoiding inflammation in the mouth, in the body, and in the gut, very important in the digestive tract too, helps through many interconnections. Crucially, to enable healthy longevity for the organism and also for mental potential, because ultimately our mind must also function, and for that you need neurotransmitters, which come from a healthy gut environment, and so on and so forth. A healthy bite, a healthy smile, a beautiful smile. Beauty is, of course, always interpreted differently by individuals. But yes, a beautiful, healthy, inflammation-free dental aesthetic also contributes enormously to positive self-perception and a positive, healthy sense of life, including in social interactions, so again, many different mechanisms. And the positive thing is we can do an extreme amount through simple measures. So as I said, regarding nutrition, the omega-3 index, avoiding all pro-inflammatory things, and treating inflammation in the oral cavity. Yes, you need professional help for that. There are great methods to get that done effectively, efficiently, and also relatively time efficiently to treat it. And then also contribute yourself through awareness and knowledge so that in the future, through a certain discipline, know-how, and lifestyle and nutritional management, you contribute to eliminating these negative factors as far as possible. The 80-20 principle would basically be enough. You don't need a totally nerdy 100% principle. 80-20, you can already achieve an extreme amount with that. And with that, you can support maximum performance, joy of life, entrepreneurship, as well as mental and spiritual development, and of course, simply enable longevity. And yes, supplementation also plays a role, of course. Yeah, so these to-go options are sometimes quick measures that bring about an improvement relatively fast. So to name a few, omega-3, great fish oils, magnesium, very important in a highly absorbable form. Those are just some very simple tools. Avoid sugar, yes, that's it. Avoid the wrong fats, trans fats, and so on. Ultimately ensuring that all roughly 50 essential, nutritional substances, vitamins, trace elements, amino acids, very important healthy fatty acids, and so on and so forth, all the way to lithium, are present in sufficient amounts in the intake. And with that, I've actually created the optimal conditions for longevity to occur as effectively as possible.
Mm-hmm. So in summary, it's about longevity, meaning understanding and recognizing systems early on to avoid diseases, to then ultimately implement health-promoting measures with the correct strategic focus to build the best foundation.
Yes.
Thank you so much for listening today. And if you have any questions yourself about health, wealth, privacy, or AI, please ask us or suggest topics that interest you. We will be very happy to answer them. Until next time.
Until next time.